I'm a senior and I'm a sociology major. This summer I interned at Voices for Virginia's Children. I actually started interning early in February with the help of Judy Mejia, the program manager of the Richmond Families Initiative. Unfortunately, she isn't here tonight. Just to give you some background information about Voices, Voices is a nonprofit advocacy organization that supports policies that enhance the lives of children and families in Virginia. They do so by conducting research, building coalitions around the state, and developing public policies that help children in the state. They focus on 5 main policy issue areas. That includes early care education, family economic success, foster care adoption, and health and children's mental health. For the rest of the presentation, I will focus on some of these policy issue areas and talk about some emerging trends that I saw in the data that I analyzed. For the most part during the summer, I worked primarily inputting data into the Kids Count National Data Center. Kids Count provides an in-depth, comprehensive comprehensive data analysis on child well-being in Virginia. The 4 domains that the Kids Count focuses on is education, economic well-being, health and safety, and risky behaviors. Moving on to talk about the poverty data that I saw in Virginia. In the past couple of years, there's been increasing children living in poverty in Virginia. Part of that is due to the recent economic recession. That's really accelerated a lot of families moving into poverty in Virginia. For instance, according to some of the Kids Count data that I analyzed, as of 2008, 14% of children in Virginia were living in poverty, as compared to 13% in 2007 and 12% in 2006. And this rate is steadily increasing because of the effects of the recession. It's important to understand what affects a family's chances of getting into poverty. There are multiple factors, but the most powerful predictors of getting into poverty are work and marital status. A lot of times when I analyze data and talk to people in the community, I found a lot of families who were in poverty were unable to find long-term stable work or employment, and were single or didn't have a spouse who was working. And just to give you some demographics about the characteristics of families in Virginia who are poor, the families who are, or people who are most likely poor in Virginia were children, those who are less educated, African Americans and Hispanics, and non-working adults. And surprisingly, when I sort of analyzed my data or looked at some of the trends that are happening in Virginia, I found that a lot of communities with the highest risk of poverty were located in southern and rural communities of Virginia, as opposed to urban and suburban areas. Most of the poor in Virginia live in these urban areas. So it's something that policymakers need to understand when they try to develop policies that alleviate poverty and reduce it. And there are many ways to reduce poverty, but some of the 2 basic factors that would reduce poverty the most were to be able to obtain an education and find full-time employment. Those are the 2 biggest factors for raising families out of poverty. And also a secure safety net provided by the government will help reduce poverty as well. Now going on to education. Earlier this year, Kids Count published a report highlighting the importance of reading at proficient level by the 4th grade. For those of you who don't know, there's sort of a switch that happens going on to the 4th grade for students. They sort of come from reading to learning to learning to read. Learning to read to reading to learn. And by the 4th grade, if you don't have proficient reading skills, you might lag behind in school later on in life. And for the most part, most students in Virginia, according to the Standards of Learning, are at the basic reading level. 86% of students were at proficient reading levels at statewide across Virginia. However, when we separate the reading levels by race and class, you notice that a lot of African American and Hispanic students actually have lower reading proficiency rates compared to the other students, and students who are economically disadvantaged. I also worked with staff members that understand foster care and adoption system in Virginia. Unbeknownst to my knowledge, in 2007, a reform group was established to help change the foster care system in Virginia. Previously, there was no tracking system or sort of like organized body in Virginia understood the outcomes of children entering the foster care system. But CORE was founded to really track down on the foster care system in Virginia and make sure that there are positive outcomes happening when children enter it. Because of that, there's been an increased number of children entering into permanent homes in Virginia. There's been decrease in the foster care caseloads for caseworkers. There's a decrease in care placements for children in foster care and an increase in family-based placements. I think what I've heard from a lot of policymakers and people who have voices is that a lot of people are emphasizing or encouraging reform in the way that children are placed in either family-based settings or primary care settings. Family-based settings are more preferred because they encourage children to be with a family, to develop with them, to really feel nurtured, versus the primary care group setting because it's sort of like an institutionalized way of raising a child. It's not really good. And then to my final policy issue area, children's mental health. This is something that's not really talked about in politics or in the mainstream media that much. One of the biggest challenges that voices had to focus on was understanding the issue, understanding how many families in Virginia suffer from mental health issues, and raising awareness about it because it's such a silent issue that no one really is afraid to talk about such a taboo type of subject. And building connections with the community, building bridges between mental health care providers and people seeking the services. And then on the final note, there's some important things I've learned that weren't really so much in the data and policy research that I did. The interplay between politics and policy. There's a lot of times in the Voices office that we developed great policies to present to politicians, but they weren't really attractive to them because it was a part of their agenda. And so it's sort of difficult trying to shape policy that's more attractive to these legislators and that would really help the families in Virginia. I didn't realize that the numbers really matter in the long run, trying to improve the importance of a policy, why policy is important, who needs these services, and how many people are affected by it. And raising awareness about a topic. A lot of times too, many people, even politicians and regular folk, didn't understand anything about certain topics, for instance, children's mental health. It was sort of unbeknownst to a lot of people, including myself. And I want to say thank you to the Burhans family, to my faculty mentor, Dr. Warren, Judy Mejia, who's not here, and Dr. Amy Howard, and Casey Price, and the rest of the CC staff.